Okay, we started the day out by hearing about the Institute of Medicine report and the National Pain Strategies. And one of the things that always sticks in my mind is that need for cultural transformation. And all day I have been hearing about all the people with pain who are using medication and maybe misusing them. But what I didn't hear were about the people who are out there working and living and making a living and struggling and maybe taking an opioid to allow them to do that. So I don't want to forget those folks, and there's a lot of them out there. And I think we need to sort of make sure that we represent people with pain in the right light. They're not all out there seeking drugs, but I think the more that we focus on the misuse and abuse around opioids, the more it becomes difficult for a person with pain to actually access appropriate treatment, because there's this huge stigma. So we do need a different point of view when we're looking at a person with pain. No one asks to have pain. I'm also a person who's been living with pain for many, many years. But I also think, and as I said before, the person with pain has really got to be part of that treatment team. They can't be a passive patient. They have to become an active participant in their health care. You can't just tell someone to learn to live with pain. You have to teach them how to do it. So that education. The problem with teaching someone how to do it is providers don't have time, and they've never been trained either. We heard about education and the need for providers who need that more education around pain management. And I've talked to many of them over the many years I've been doing this, and they'll all tell you that they've been trained on prescribing and procedures. They've really never in the last 20, 25 years. I mean, years ago, I was fortunate enough to go through a pain management program 37 years ago. It was an inpatient multidisciplinary. They can make a significant difference in your life. They allowed me to move from patient back to person again. And so I was able to get all of that. But I think that opioids have a place, but they're not for everyone. We have to become part of the treatment team, but there's another piece of that. Once you get a person, and I think it's part of that is when we look at acute pain and we go and visit our providers quite often, and I heard Daniel just say this, they give you, opioids. That seems to be a thing, dental treatments, whatever. I think we need to have a better time to really do an intake on somebody who has acute pain to really understand what the issues are so that we might prevent long-term chronic pain. And I haven't heard anything about prevention today either, but I think we need to do a better job of looking at acute pain. How can we treat that more appropriately so perhaps we can prevent chronic pain? And when it comes to treating a person with chronic pain, when they go to that, so finally they say, okay, this pain is going to last, you're going to have to live with it. When they go to their provider, how long do they have to talk with them? And we've heard it's the typical 10 minutes. We need to really change the reimbursement system so that they have longer to talk to these patients to really understand what it is they need. What is the best appropriate treatment for them? And it may or may not be a medication. It may be a combination of different therapies. Everyone is different. We've heard that over and over again today. We're all different. We all have different needs. One of the things that always struck me is, what is the expectation of treatment? And most of us want that instant fix. We're instant society. We want that quick pill. We want the instant fix. And so we expect a quick pill, go home, feel better. But if you look and talk to someone who has been living with long-term chronic pain and ask them what is their expectation of treatment, it's going to be quite different, I think, than what you think. And it's not to get rid of the pain. They want to be able to go fishing again. They want to be able to play with their grandkids. They want to be able to drive their car again or just go and see a movie. So I think, what are the goals of people with pain? And I didn't hear anything about that today. And that still all plays in to this whole treatment modality. I think the CDC guidelines, I've talked to so many people about them, and what that has done is limited access to care for people. I can't tell you how many calls we get every day in our office from people who have been told, we can no longer prescribe for you, you're going to have to find someone else. And of course, there's no one else. We heard there's 5,000 certified pain specialists in the country today. That's not enough to treat the 100 million people. Where do they go? We just did a survey on access to care, and we surveyed over 1,000 people, and 40% of those people, if they can't find access to care, their response was suicide. 40% of the people. That's unacceptable. And what's happening when they're not having access to care is they're not tapering them off of their medication. They're just saying, go away. And that's why we're seeing all the need for it in the emergency department. I think that alternative therapies, I think we need to again, it goes back to the reimbursement. I think we really need to focus more on a lot of the alternative therapies. Maybe opioid is not the first line. I mean, maybe they actually need physical therapy. Maybe they need, I mean, we don't know. Every person's so different, we have to look at them. Again, it's the reimbursement. Most people, and we talked about this too, we didn't really talk about it. We talked about all the people that we're talking to are people who are prescribed opioids, the providers. But if you'll step back, and we've heard this, the problem is in the public. And I didn't hear anything today about public education. And what are we doing to educate the public about these dangers of these drugs? I mean, we need to do a better job of letting these kids know the dangers of taking these opioids or any of these prescriptions. And they think if it's an over-the-counter, if it's a prescription medication, it's obviously safe. It's an over-the-counter, it's got to be safe, take as much as you want. They don't understand combining drugs. They don't understand combining drugs and alcohol. There should be more educational programs in the schools themselves to teach these kids around these dangers, and I don't think we're doing that. And you know, it goes back to the person with pain. I really think that we need better communication between providers and people with pain, because providers talk up here, people with pain understand down here. So we really need to change that dynamic to allow them to have some kind of education or some kind of tools to have a better and more meaningful conversation with that person with pain, so they can actually understand what they're being told and what the expectations are. And I didn't use all my time up, but that's really, you know, all I have to say. I think it's really important to look at the person with pain in a different light, to see that what they want is they want their lives back, and perhaps an opioid might be one of the things. And I think it's, and I do have something else to say, it's the fear of the pain. And I think that's what causes so many people to take more. If one is not doing the job, then two will be better, and I'm going to take two. And it's that fear, because we never know how bad that pain is going to be and when it's going to hit. We don't know that. It's never consistent. Pain is never at the same time all the time. And so there is that certain amount of fear that we have, that we don't know when it's going to hit and how bad it's going to be. And so if there's something that we absolutely have to do, if we have to attend, quite often people are going to take more just to make sure they make it through that. And that quite often is where the problem is. Again, that's why we need to have better communication, more options of treatments, and knowing that pain is going to be something that people will have to live with for the rest of their lives. It may never go away. And when I tell people that, you know, there may always be some level of pain, but the good news is you can live with it. But someone has to teach you how to do that. Thank you. And thank you all today for inviting me and the wonderful talks we had.